Hi everyone, Adam here from Kinetics Physiotherapy. Got another video this time about patellofemoral joint pain. So patellofemoral joint pain essentially refers to the knee, and we're looking at the kneecap in particular. So the patellofemoral joint, the patella is the kneecap and the femur is the bone in your thigh here, and as it comes down to the knee joint where those two bones meet, that's where you can get a bit of irritation. And essentially what patellofemoral joint pain is it's more of a mechanical issue, and it's an issue with the way that you move. So often people get pain around the kneecap at the front of their knee, and it's usually when they're going downstairs is one of the main tricky things with patellofemoral joint pain. But essentially what causes it is as the thigh bone comes down towards the knee, and it forms the top part of the knee, and you've got the tibia, your shin bone, which comes up to make the bottom part of your knee like this, and you get the hinge joint. As the femur comes down, it forms almost like a knuckle, and in that knuckle there's sort of a groove in between these two bits here, and that's where the kneecap sits, the patella. And essentially as you bend and straighten your knee, the patella moves up and down in that groove. And if it's not tracking correctly, straight up and down, if there's a bit of deviation to one side or the other, that can cause irritation of the area, and that's what can cause patellofemoral joint pain. And you can get pain around the kneecap usually, but it can refer a little bit further down as well, and sometimes a little bit further up as well, but generally it's towards the front of the knee. And the main things that cause that maltracking or the poor mechanics of that kneecap is usually weakness in two areas. Usually we look at the inside muscles of the thigh here, so you've got your quadricep muscles that sit at the front of the thigh, and there's one towards the inside here that sits just next to the knee on the inside here, called your VMO muscle, and it's often blamed if it's not strong enough, it can cause the deviation of the kneecap. Also, we've got the muscles around the outside of the hip. So what they do is they sort of stabilise the knee as well, because they come down this side via the IT band into the outside of the knee. And if again they massively impact the mechanics of the kneecap. So if these muscles around the outside of the hip aren't strong enough, that can cause kneecap related issues. Between the two of those, generally from a strength point of view, that can cause issues. It can be tightness in the quad muscles here as well, but it's less common cause of patellofemoral joint pain. But today in this video we're going to look at exercises to strengthen the muscles on that VMO muscle on the inside of the thigh here, in the quadriceps, and also on the outside of the hip as well. Between these exercises we're strengthening both these areas, and it should help stabilise that knee and can help with patellofemoral joint pain. So, like with all the other videos where we go through exercises, I am a physiotherapist, but I haven't seen any of you that might be watching this at home. So if you do have pain in your knee, before you start doing any sort of exercises, make sure you go and see somebody, just to either your GP or a physio as well, and they can have a look, make sure that's what the problem is, and then steer you on the right path, and they might suggest some of these exercises as well. So what we're going to do, we're going to look at 3 exercises laying down, and there's a couple in standing as well, which will really help tackle these problems. So the first one that I want to do is to have a lay down on your back. And then if we're looking at my right leg, just get comfortable, I'm going to straighten the leg that's going to be exercised here. And then what I want you to do is rotate the leg so the toes are pointing outwards, away from you. Keep it rotated, keep the leg straight, and then lift it up towards the ceiling, just so it's level with the sub leg, and then come back down again. So we're just sort of varying a straight leg raise. So if we're looking at a normal straight leg raise, you'd have the toes pointing up, and you would just come up and down. But as soon as you rotate the leg out to the side and keep it there, it targets the inside of the thigh a bit more, so we're looking at that VMO muscle a bit more. But you're going to raise the leg up, and then back down again. This should be a nice, slow, controlled movement. Usually aiming for between 8 and 12 repetitions, have a rest, and then try and do 3 sets together. Okay? So, the next one that we want to do, now have a lay on your side. So I'll stick with my right leg. So you're going to have a lay on your left side with your knees bent. Just adjust my microphone. So, with both knees bent, you're then going to roll your hips forward. So imagine there's a pole going through your hips here. So one hip is on top of the other. You shouldn't be leaning back and you shouldn't be leaning forwards at all. Try and keep level, one on top of another. And then what you want to do is straighten that top leg, keep the sort of foot parallel to the floor, and lift it up towards the ceiling. So when we lift the leg up, you're engaging these muscles here on the outside of the hip, and then come back down. See it a lot in Pilates, it's quite a common exercise, but lifting up there, don't have to go all the way up to the top, just go around parallel to the floor, maybe slightly higher. You should feel the muscles engaging there. Pause for a second or two, and then come back down again. And then up again. So again, similar to the straight leg raise that we did just a second ago, aiming between 8 and 12 repetitions. And what you can do as well, which some people might find a bit more challenging, is to rotate the foot. So you can always rotate the foot so the heel is leading. That generally is a little bit trickier, just because it recruits smaller muscle group. And then up and down. Make sure it's nice and slow. Okay. And the last sort of floor or bed-based exercise, I'm going to need one of these. So, what you want to do is grab this band. Mine isn't tied together. You can get some that are already in a loop, that's absolutely fine. Essentially you want to tie it quite tightly around the knees. And then what you want to do, have your feet shoulder width apart and have a lay down on your back. So then in this position here, hands by your side, and then we're going to go through a bridge, which there's one of my previous videos which is to do with hamstring injuries. We're looking a lot of bridge variations, and if you have a look at that video, I'll put a link to it or add it to the screen if I can figure out how to. And it goes through quite thoroughly how to go through a bridge. But essentially, putting this around the knees, apply a little bit of tension, so the band should be pulling your knees together. Make sure that you're pulling it apart. Keep that tension, and then peel the hips off and up towards the ceiling. And there should be a straight line from your shoulders down to your knees, okay? And then come back down, nice and slowly. So all of these exercises should be nice, slow and in control. None of them should be quick. So coming up, coming down nice and slowly. To make this a bit more challenging, you could add another band around the knees, just to give you a bit more of an emphasis on pulling them together. And then again, come up to the top, pause for a couple of seconds, and then slowly come back down. You should feel a bit of engagement around here as well, potentially in the abdominal muscles as well. So, stop here. So we're going to need this band for the other two exercises, which we're going to do in standing. So I've just changed the camera angle slightly so you didn't chop my head off in those videos, but we're going to need this band for the other two exercises. So the first one is going to be looking at a squat, but with a bit more of a bias towards the outside of the hips here. So if you have patellofemoral joint pain, generally squatting can be quite uncomfortable. So with this one, it's really important to just go down as far as you're comfortable with. You shouldn't be pushing through any significant pain with any of these exercises. You might be a little bit uncomfortable, shouldn't be anything more than that. So with this one, I'm just going to get this band here. Mine's already tied from before, but you just want it tied above the knees. So then what you're going to do, feet shoulder width apart, feet slightly rotated out a little bit, and then what you want to do is try and squat down as far as you're comfortable with, and then back up again. So again, just as far as the knee is happy to do so, and going down and up again, and try to make sure you're pushing out against that band. Make sure that the band doesn't pull your knees together. Okay. So you can do this if you're not feeling very confident with a chair behind you, and sit back down into the chair and then stand up from the chair. The main thing is, what you don't want to happen is the knees to come in when you're squatting down. You want to push out against that band that engages these hip muscles here, which is what we need to strengthen and stabilise that knee. And for the last exercise, again we're going to need this band, but this time just slide it down and have it round your feet. So what you want to do, I've got a mat on the floor, but you just need a length of kitchen counter if you want a bit of support, but just a bit of space to walk to the side. And you're going to have your feet shoulder width apart, so a bit of tension in the band already. And then what you want to do is have a slight bend in the knees. Keep that bend in the knee. Again, if it's sore for the knee, come up a little bit. But then what you want to do, keep that bend, and then just do some very small steps to the side. These should be really small side steps. So I'm just going to go the length of the mat and then walk back. You should really feel a bit of tension in the thighs here, but also around the outside of the hips as well. So it's working both these sort of VMO muscles and also those outer hip muscles. Just going from one side to the other. And if I was a bit unsteady on my feet, you could have the kitchen counter there, just in case you need it for a bit of support. And if this is too difficult with a band, just do it without the band. Even without the band, when you're stepping out to the side, every time you step, you're engaging that muscle, so you're still working it. This is just for a bit of progression. But essentially, if you can do those 5 exercises, all 5 of them, you should be aiming between 8 and 12 repetitions. So if we're looking at the side stepping one, try and do 8 steps to one side, 8 steps to the other, have a break, try and do that 3 times. And if we can do those on a daily basis, you should start to see some real improvement in the knee. So that concludes our exercise video for patellofemoral joint pain. Some of these exercises as well would help if you had other conditions such as knee arthritis, or can work for hip arthritis as well, because it's strengthening and stabilising both the knee and hip. So if either of those, actually these exercises can double up and help with those significantly as well. But again, it's all to do with getting checked first by a GP or a physio or a doctor that'll say actually yes, that's the condition, and then only do what's manageable. With any of the exercises or any others that you try by anybody else, they shouldn't be painful, at most just a little uncomfortable. But give these a try, let me know how you get on, and if you have any questions, like always, let me know. Leave a comment below. I always read the comments and get back to you guys if you write anything. So definitely let me know, and let me know if there's anything you want me to go through in the future. I'm going to upload a couple of other videos on patellofemoral joint pain, looking at other things like acupuncture to help with it, and also taping can be quite nice to try and ease the pressure on that joint, to try and give you a bit of respite really, and then you can do more of the exercises. So watch out for those couple of videos, but if you found this video helpful, leave a like, subscribe, please share it with anyone else that might find it useful, and I'll see you in the next video.